Thank you. And I guess the best way, I was going to say it's great to be here. I think I should add, at last. Sorry for keeping you waiting, but there I was in the cold. My general message is particularly aimed at the medical care system. What good does it do to treat people and send them back to the conditions that made them sick? Too often people equate health with health care. And when they think about inequalities in health, they assume it's inequalities in healthcare. But indeed, as I laid out in my book and my various reviews, inequalities in health arise because of inequalities in the conditions in which people are born, grow, live, work, and age. Since I published my English review in 2010, excuse me, we've been monitoring what's been happening to health inequalities, and the social determinants of health. Last year, actually the year before, summer 2017, we drew attention to the fact that life expectancy increase had slowed down. Thank you. Had slowed down. This goes back to the 1980s, but if you extended it back to 1920, at the end of the First World War, life expectancy has been increasing about 1 year every 4 years. 1 year every 4 years. That's 6 hours every 24 hours. If you spend 6 hours here today, you get that for nothing. In fact, if it enhances your knowledge and well-being, you may actually extend your life expectancy. And that remarkable increase that went on for 90 years in 2010 stopped. My goodness. For males and females, it was flat. I hadn't quite anticipated how much interest there would be, and I spent, when we published this, a full day, starting with the Today program and touring around the studios, and I got to back to the BBC late in the afternoon. This is irrelevant, but I'll tell you anyway. I was going to a posh dinner at the Royal Society of Medicine because I was, all right, I will tell you, because I was getting a gold medal. So I'm wearing a black tie and tuxedo and walking from my office at UCL to the BBC, and I was really embarrassed. It was sort of 4 o'clock in the afternoon, walking through London in a tuxedo. Of course, in London, nobody gave me a second glance. I could have been wearing a clown uniform. And I arrived at the BBC in my tuxedo, and they took one look at me and they say, we've stopped that dress standard around 1940. People are more casual today. Anyway, so I go into the studio, and there on my smartphone is a tweet from Jeremy Hunt, Secretary of State for Health. And the tweet says, "Respect Marmot." There wasn't actually any punctuation, so I didn't know if it was "Respect Marmot," "Respect Marmot." But, and as we know in academia, you can ignore everything before the but. Respect Marmot, but since he was on the Today program this morning, life expectancy for men has increased by 61 minutes. I scratched my head and tweeted back, "What are you saying?" ? That the Office for National Statistics got its sums wrong? If ONS got it right, let's discuss. So I go on to the RSM, the Royal Society of Medicine, and meanwhile somebody has tweeted, "Ooh, Jeremy Hunt's picked a fight with Marmot." My money's on Marmot. And the president of the Royal Society of Medicine's making this speech, and he's going to give me a gold medal, and he interrupts from his text, and he said, "I never thought I would say this. I feel a bit sorry for Jeremy Hunt." Well, the fact is, it had slowed down. And of course, it was a matter of great sensitivity. What did happen in 2010? There was a change of government. And I was asked by the BBC, could this be due to austerity? I said that over quite a long period of time, from the 1970s to 2010, NHS funding had increased in about 3.8% per year, every year. And from 2010 on, the increase was about 0.9% per annum. And if you think NHS inflation should be about 2% above general inflation, that's a cut. The adult component of social care spending went down by 6% from 2009-10 to 2015-16, at a time when the elderly population increased by 1/6. So the per capita spend on adult social care went down, and both of those, the relative decline in health care expenditure and in social care, will have an adverse impact on the quality of life of older people. I don't know, I said, whether that will lead to a shortening of life of older people, but it's urgent to try and find out. But could it be due to austerity, asked the BBC. Oh, God, And finally I said, I've been told by one of your colleagues, if you get asked the same question 3 times, just bore them to death. Then there was a piece in the Sunday Times, a full-page piece, attacking me, saying, don't blame Tory cuts. Well, I just took about 5 minutes to say why it was urgent to investigate the degree to which austerity could lead to a shortening of life expectancy. I hadn't blamed Tory cuts, but this commentator said it could be obesity, it could be the flu, it could be an artifact, it could have been a cold winter, it could have been anything but austerity. And I wrote a follow-up piece, and I said, I'm surprised by his certainty. I expressed uncertainty as to the causes, but he knew austerity had nothing to do with it. Where did that certainty come from? Well, it's an important question. One question I did get asked was, well, have we reached peak life expectancy? It's got to slow down sometime. Yeah, that seems to make sense. So we looked at other countries. Whether you can see this well, the pale is 2006 to 2010, and the darker colour is 2011 to 2015. This is women, but similar for men. And what you can see is for each of these European countries, in general, there was a slowdown. The second 5-year period, the life expectancy increase was less than in 2006 to 2010, which is entirely consistent with the effect of the global financial crisis and policies of austerity that were put in place in the wake of the financial crisis. But we're on the bottom. We're the worst. The slowdown in the UK was more marked than anywhere else. And to say why I wasn't just being a rather boring academic in being cautious, there's Greece. So they had a marked slowdown. Our slowdown was worse than Greece. If it were austerity pure and simple, you might have expected Greece to be worse than us. So it's not just simple. That said, it doesn't exonerate austerity. We need to look at it, but it's a matter of big concern. A year later, so the end of last year, the change in life expectancy at birth has got even slower. In England, it's just in the UK. In England, it's still noticeable. This is in weeks, 2014-16 to 2015-17. So there's a small increase in England, scarcely noticeable. In Northern Ireland, a marked decline in men, really no change in women, a decline in men and women in Scotland, a decline in Wales. That's not supposed to happen. Health's supposed to get better all the time. That's what we've been expecting for 90 years. Every year, year on year, health kept improving. It's not supposed to happen. I wrote to the Secretary of State and said, you need to treat this with the same urgency you would a winter bed crisis. And he did. He ignored them both. I'm not party political. I have a one-track mind, health and health equity. The political nature of the party is not the issue for me. It's what's the likely impact on health inequalities. And we can see that health inequalities have been increasing for females and males. This is the so-called slope index of inequality. I won't go into how it's calculated, but the fact is it's been increasing. I hasten to remind you, I said it 2 minutes ago, I'm not party political. This is an empirical question, asking the question, can you do anything about it? So we've got these health inequalities. They're increasing. The increase in life expectancy has stalled, or in Scotland and Northern Ireland and Wales gone into reverse. Can you do anything? Well, New Labour did have a strategy to reduce health inequalities. Any evidence that it made any difference? Colleagues at the University of Liverpool did look at this question, and they looked at trends in life expectancy, the gap between the poorest 20% of local areas and the rest. Okay? So in the period 1983 to 2003, for men and women, the gap in life expectancy between the poorest 20% of local authorities and the rest increased. New Labour was elected in '97, took a while to elaborate a strategy and put things in place and for it to start to bite. And in the period 2004 to 2012, the gap in life expectancy between the poorest 20% and everybody else got smaller, went down. Negative, got bigger, it got smaller, the gap reduced. A new government, coalition government, came in 2010, took a while to ditch the strategy and do new things, and the inequalities increased again. Correlation is not causation. I went to a statistics lecture, and as a result, I know correlation is not causation. So this doesn't prove that that set of policies led to a reduction in inequalities, but it's consistent with it, and it shows that the level of inequality that we have is not fixed. And if it's not fixed, it suggests there are things we should be able to do about it. And I ask the question, does the USA represent the future? Life expectancy in the US declined 2 years in a row. In November, this globalized world we live in, I was sitting at a meeting in Hong Kong when I got a call from the BBC World Service in London saying that day they just published, the US Centers for Disease Control had just published that life expectancy in the US had declined 3 years in a row. That orange nightmare in the White House keeps boasting that this is the best America's ever been. Does he know that Americans are getting sicker and dying earlier? Does he care? I think of health and health inequalities as the best measure we have of how well a country or a society is doing. And if they're getting sicker, something's going terribly wrong. And in fact, I don't blame Trump for that. I blame the health problems for Trump. Because look at the causes of death. Unintentional injuries. And unintentional injuries include accidental drug overdose. 63,600 deaths. So with the new figures, it was 70,000 deaths. Poisonings, suicide, alcohol are responsible for the increase in mortality in middle-aged Americans. And the increase is steeper the fewer the years of education. In the US, they talk about it as deaths of despair. And that's why I say, I think the problems caused Trump, not Trump caused the problems. The despair of large swathes of the population that lead to self-harm and premature death lead to voting Trump. You either kill yourself or you vote for Trump, and I think there are probably alternatives, and he may well kill the rest of us. I should be careful what I say about feeling disaffected and voting because of that sense of disaffection. I won't get into this. Let me just say one thing, though. I have an elderly aunt, aged 90, who I think in her spare time could write editorials for the Daily Mail. I don't think she does, but she voted to remain, not because she was in favour of remaining, but because she knew her grandchildren were in favour of remaining. And I would say that anybody who voted leave, did you think about your children and your grandchildren, who overwhelmingly want to be part of the European Union? Lecture over. So what's been happening to inequalities in the US? This is life expectancy at 50 by year of birth. People born in 1920 will be 50 in 1970. People born in 1950 will be 50 in 2000. And deciles of income. The poorest 10%, next 10%. So there's the gradient. The richer you are, the longer the life expectancy. Now look what happened over this 30-year period. There was a small increase in life expectancy at 50 for men. This is men in the bottom decile. A bigger increase for the second bottom decile, bigger for the third, and so on. The gradient got much steeper. The inequalities got much bigger. Are you ready for my next slide? I think I ought to get informed consent before I show you this. That's women. My goodness. Life expectancy declined for the bottom decile, declined for the next 10%, declined for the next 10%, for the bottom 30% of the income distribution. Life expectancy for women at age 50 went down. Inequalities are getting bigger. Things are going terribly wrong. And I ask, is this our future? And if we look at young people in the US, neonatal mortality, suicides at age 0 to 19, mental health, age 11 to 15, drunkenness, and teenage fertility. UNICEF produces a report card for all of these countries, and all of these countries are better than the average, and all of these are worse than the average, and there's the United States. Not great. And so you can see it's not just deaths of despair in middle-aged people, they're building up problems for the future because of these psychosocial problems in young people. And I dwell on the US a little bit. Firstly, because it's a stark warning, is this where we're heading? But secondly, to make the point about the mind. The mind is an important gateway by which social determinants affect ill health. Mental illness and well-being, and psychosocial pathways to physical illness, behaviours and stress pathways. And we see the deaths of despair in the UK. Colleagues in Glasgow a few years ago, David Walsh and his colleagues, looked at mortality in Glasgow relative to Liverpool and Manchester. Similar levels of poverty and inequalities in the three cities, but Glasgow has higher mortality. And what are the diseases that show the biggest relative excess in Glasgow? Drug-related poisonings, alcohol, suicide, and external causes of death, accidents and violence. These are the deaths of despair, the same causes of death that we're seeing in the US. And Harry Burns, former Chief Medical Officer of Scotland, commenting on these, said, a major element of the excess risk of premature death is psychosocially determined. Low sense of control, self-efficacy, and self-esteem. So it's to deal with these kinds of problems that I chaired the WHO Commission on Social Determinants of Health. We reported in 2008, and we called our report Closing the Gap in a Generation, a statement that these dramatic gaps in health that we see between countries and within countries could be closed in a generation. We have the knowledge to do it. And we said on the cover of our report, social injustice is killing on a grand scale. And we put at the heart of what we're trying to achieve empowerment. Material. If you don't have enough money to feed your children, you can't be empowered. Psychosocial, having control over your life, not suffering from deaths of despair. And political, having voice. And we talked about improving the conditions in which people are born, grow, live, work, and age, and dealing with the inequities in power, money, and resources that shape these conditions of daily life. And in the wake of the WHO Commission, I did the so-called Marmot Review, Fair Society, Healthy Lives. We did a European review, and literally, almost literally, as I speak, I was working it on the plane, on the train, on the way up, we are finishing our report of the Commission of the Pan American Health Organization on equity and health inequalities in the Americas. Social determinants and health equity is on the agenda. I hope you'll remember that in my English review, I had 6 domains of recommendations. Give every child the best start in life, education and lifelong learning, employment and working conditions, having enough money to live on, and the 5th, sustainable communities, places to live and work, and a social determinants approach to prevention. So to come back to the title of my lecture, Gateshead, a Marmot City, ? There's much that can be done at city level on each of these 6 domains. It doesn't let national policy off the hook. Ideally, we need favourable national policies, but there's much that can be done at city level. And I want to illustrate that. So we took a life course approach, give every child the best start in life. And I said we've been monitoring since I produced my English review at regular intervals. I said I'm not party political, so if I ask you to look at the blue dots, that's not a political statement. But if you would, focus on the blue dots. What we've got here is the percent of children age 5 with a good level of development for each local authority in England by level of deprivation. So to the right, as you look at it, you've got the least deprived local authorities, to the left, the most deprived. And what you see is the more affluent the local authority, the higher the proportion of children who have a good level of development at age 5. The line slopes upward. They scatter around the line, so for a given level of deprivation, some local areas are doing better than others. But one strategy to reduce inequalities in early child development would be to reduce deprivation, bring the level of these poorer neighbourhoods up towards the middle. And early child development is important because that sets what happens for the rest of the life course. Children with a higher level of development at age 5, greater readiness for school, do better in school. Young people who do better in school are more likely to go on to further education and get a better job, higher income, live in favourable conditions, be your thriving, maybe managing, but not the other groups. And it all starts early in life. And I said some are doing better than others. Now look at the red dots. The red dots are children eligible for free school meals, the poorer kids. And when I first saw this, I have to confess, a bit irritated, because I'd predicted the opposite, and I hate being wrong. The evidence is really important. If the evidence says you're wrong, mate, I was tempted to do what any scientist would do. Faced with evidence that contradicts your hypothesis, you get rid of the evidence. A good hypothesis is hard to come by. You can always get some more facts. But I couldn't get rid of it. I said, let's recode it. Let's check the analysis. But there it was. It was very stubborn. And it was the opposite of what I'd predicted. I'd predicted confidently that poor kids would do even worse in poor areas. They don't. The poorer the areas, the better do the poor kids do. Poor kids do much worse in affluent areas and much better in poor areas. Got to think about that one. So I went to Hackney. Look at England first. So 60% of children age 5 have a good level of development. The poor kids eligible for free school meals, just under 45%. The gap's 16%, just under 16%. In Hackney, the poor kids are doing as well as the English average. Now you say, Hackney, wait a minute, isn't Hackney being gentrified? It is. My daughter just moved into Hackney. But there's a lot of poor kids in Hackney. And the poor kids are doing as well as the English average. The gap's 4%. Look at Bath and North East Somerset. The poor kids are doing really poorly. The gap's 29, nearly 30%. My guess is, and I don't know this, but my guess is the reason they're doing so well in Hackney is because there's so many of them. And talking to directors of education in Hackney, they say, we tell ourselves every day, poverty is not destiny. What we do in our day job is trying to break the link between economic disadvantage and poor child performance. And by golly, they're doing it. And if I showed you GCSE performance, it would be the same thing. The gap between the poor children eligible for free school meals and the average is much lower in Hackney and indeed in London. There is a London effect. And part of it, I think, is probably pretty simple. The spending per child is higher in London than the rest of the country. The government noticed that. They said, that's unfair. Let's reduce London spending. No, don't do that. Let's increase spending elsewhere. What better use could you find for your money than spending on education? Yes, equalise it by improving the spend in the rest of the country. So the London effect can be a Gateshead effect, and a Tyneside effect, a Liverpool effect. The other side of early childhood is not the good side, but the bad side. Adverse child experiences. If you look at adverse child experiences by income, incarceration, drug abuse, sexual abuse, alcohol abuse, domestic violence, physical abuse, mental illness, verbal abuse, and parental separation, they all follow the social gradient. These adverse child experiences are more common as you go down the social hierarchy. And the effect of ACEs is dramatic. If you could prevent people having 4 or more adverse child experiences, you could reduce early sex by 1/3, unintended teen pregnancy by 38%, smoking by 1/6, binge drinking, cannabis use. Look at this, violence perpetration. Half the perpetrators of domestic violence suffered from 4 or more adverse child experiences. And even more chilling, half the victims of domestic violence suffered from 4 or more adverse child experiences. Incarceration. We don't lock people up randomly. We lock up damaged young people. We take young people with mental illness and we put them in prison. Can you think of a worse place to put somebody with mental illness? Somebody who's suffered 4 or more adverse child experiences? Yeah, we feel so sorry for them that we lock them up. And I said we can reduce child poverty. Here, child poverty in Denmark, Iceland, I think Finland fell off the end there. I know there's Finland. Denmark, Iceland, Norway, Finland, child poverty levels are at around 9, 10, 11%, where child poverty is defined as having less than 60% median income. It's a relative measure. So that's what it could be, 9, 10, 11%. In the UK, it's just under 20%. In the United States, it's 29%. Just below Mexico, at just under 32%. Child poverty is a political decision. The Minister of Finance, the Chancellor of the Exchequer, can decide what the child poverty rate should be. In the Nordic countries, they don't like it. In South Korea, they don't like it. So they have low levels of child poverty. We seem to be quite happy with it. So we have pretty high levels, and the US positively thrive in child poverty. They love it. And it shows what the Minister of Finance can do. Reducing child poverty by social transfers in the Nordic countries, they reduce child poverty by 2/3 by the actions of Minister of Finance, social protection, and the like. In the US, they reduce it by 18%. Child poverty is a political choice. And it relates, I would say, to obesity prevalence. In children, year 6, least deprived, most deprived. This striking social gradient. And if we look at what's happened, this is year 6 girls, from 2006-7 to 2016-17, for the least deprived, childhood obesity seems to have leveled off. But for the most deprived, it's still going up. Have you heard recently people say that healthy lifestyle is a matter of individual responsibility? Have you heard that? little mantra recently? Don't blame the kids. Don't blame the children. And I ask, if obesity is a matter of personal irresponsibility, how come we're smoking less? We've got responsible when it comes to smoking and irresponsible when it comes to obesity. It's garbage. It's complete and utter garbage. It's empirically false. It's the wrong way to look at it. This is complicated. My own view, and I've said this often, is to deal with the obesity problem, we have to deal with the inequality problem. Ensure a healthy standard of living, figures you know well. If we look at distribution of people below the minimum income threshold, there are more in households where at least one adult is working than in workless households. Work should be a way out of poverty, but more than half of the people in poverty are in households where at least one adult is working. Council cuts per head, as we heard at the introduction about council cuts, and it correlates with premature mortality as a measure of deprivation. The higher the premature mortality, the steeper were the council cuts. That seems to me the opposite of investing according to need. That's the more needy is a local authority, the steeper the cuts. And the characteristic of neighbourhoods matters. This is looking at living in areas with unfavourable environmental conditions by level of deprivation. Least deprived, most deprived. This is having 3 or more unfavourable, 2 or more, 1 or more. And you can see the gradient. The more deprived the neighbourhood, the worse the environmental conditions. I said there's a lot that a city can do. Air pollution, environmental quality, green space. I really like this one. The gradient in mortality from circulatory disease. One is the relative mortality of the top income group, the next income group, the next, and the next. So people in the bottom quartile have twice, 2.2 times the mortality of people in the top quartile, classified by exposure to green space. So this is the group that has the least exposure to green space. This is the middle exposure to green space. The gradient is a bit shallower. And the group with the most exposure to green space, wow, instead of being 2.2, it's 1.7. Exercising in green space reduces the inequalities in mortality from cardiovascular disease. We also know that it improves mental well-being and reduces mental illness. Being outside in green space is good for people's health. But of course, the access to green space gets less the more deprived the area. This is a local issue. Central policies matter. Air pollution and deprivation. Overcrowded households is a measure of deprivation, and looking at different measures of air pollution. This is PM 2.5. Sorry, you can't read that. PM 2.5. The higher the deprivation, the higher the air pollution level. In London, we looked at schools by the percent of children eligible for free school meals. So the higher the percent eligible for free school meals, the more deprived the area, and the more likely are they to have high levels of oxides of nitrogen. Oh, that's great. We put poor kids in schools that have, in general, worse performance, and then we expose them to more air pollution. This can't be right. Percent of homes not meeting decent home standard by region and tenure, and social housing, private rentals. The private rental sector has much worse quality than social housing in every region of the country. And of course, in London certainly, it's unaffordable. Private rentals are unaffordable and worse quality. Young people are being forced out or living with mum and dad. Proportion of people reporting low mental well-being in good and bad housing. Surprise, surprise, if you live in crummy housing, it has an adverse impact on your mental well-being and mental illness. And conditions of household dwellings, looking internationally. And this is the proportion of children living in a household with one of a leaking roof, damp walls, etc. And the UK is worse than the OECD average. We're not the worst. Slovenia, Cyprus, Hungary, Latvia, well, that's great. We're better than Latvia. But we're not as good as the Slovak Republic, let alone Finland, Sweden, Norway, Denmark, Malta, Ireland, the Czech Republic, etc. So our housing quality is not great, and it's worse in the private sector than the public sector. Let me come back to what should happen at a higher level than the city level. We haven't got enough money to spend. Well, what about tax havens? 50% of wealth in tax havens belongs to the top 0.01% of people in advanced economies. That wealth is equivalent to 5% of global GDP. It's tax avoidance on a massive scale. And added to that is avoidance of tax by multinationals. Multinationals, tax avoidance, 600 billion euros a year shifted to the world's tax havens, 350 billion euros into European tax havens. I went to a meeting in Luxembourg and I was looking at people in the street saying, which government are you diddling? And they're probably looking at me asking the same question. When Starbucks and Google and the like were asked to appear before the Commons Public Accounts Committee, and Starbucks was asked, why don't you pay tax in the UK? And they said, we don't make a profit. Oh, isn't that nice of Starbucks, to sell coffee for the well-being of the British population? And they do it out of the goodness. How come you don't make a profit? Well, we buy coffee beans from a Starbucks company in the Netherlands. Coffee beans in the Netherlands? They grow tulips in the Netherlands. They don't grow coffee beans. They grow accountants in the Netherlands. The coffee beans come from Central America and Brazil and Colombia. They don't come from the Netherlands, but it's a nice accounting trick. The Starbucks company that sells coffee beans has a nice markup, so they don't pay tax in the UK. Remember the lie about £350 million a week? For the UK, we lose 12.7 billion euros a year in tax avoidance by multinationals. Well, it's the same order of magnitude of that falsehood about the £350 million a week we spend to Brussels. We could fund our NHS and social care by dealing with tax avoidance by multinationals and rich individuals. Coventry's a Marmot city, as you're going to hear about. So Coventry said, we can do it. Yeah, what happens at central government is very important, but we in Coventry are going to become a Marmot city. And I won't talk more about Coventry because you're going to hear about Coventry in a moment. We're talking with Manchester about the idea that Manchester, Greater Manchester, could become a Marmot region. That would be good. I was invited to Trieste. I was told it's an Italian Marmot city. And then I had to go to Bologna. I'm going to Bologna next month because they told me that's an Italian Marmot city. I asked my Italian colleagues who's asked me to go to these places, do they know that they're Italian Marmot cities? No, I just say that to get you there. But they are doing the same kinds of things that Coventry is doing. And maybe Gateshead might take on. And we're on the agenda. So we've now got a health equity network for the Americas, which we hope will be part of taking forward the PAHO Commission report that I'm labouring on at the moment. Let me finish by a little personal reflection. I spent a year as president of the World Medical Association, and I said to the doctors, why treat people and send them back to the conditions that made them sick? I was trying to get national medical associations to embrace the social determinants of health agenda. And my message to the World Medical Association, in a world of post-fact politics, is evidence-based policy presented in a spirit of social justice. I said to them, remember, we said on the cover of the WHO Commission report, social injustice is killing on a grand scale. And I was thinking about this evidence-based policy and spirit of social justice, and at one of our PAHO meetings in Washington, D.C., I went for a walk in the mall. And for those of you who don't know the geography of Washington, the Mall is that part of Washington that was sparsely populated during Donald Trump's inaugural. And I found myself in the area devoted to Martin Luther King. And Martin Luther King said, I believe that unarmed truth and unconditional love. And I thought, unarmed truth. Evidence-based policy is a slightly more prosaic way of saying unarmed truth. Spirit of social justice, well, Dr. King's a preacher, was a preacher. Unconditional love. I believe that unarmed truth and unconditional love will have the final word in reality. This is why right, temporarily defeated, is stronger than evil triumphant. There's a lot of bad things going on in the world at the moment, whether you look at Westminster or Washington or Budapest or where you look. A lot of bad things going on in the world. But I think with Martin Luther King, we should believe that unarmed truth and unconditional love, right, will be stronger than evil triumphant. Thank you.